Thank you so much, Chair, and thank you, members. I'm not sure if our freshman colleagues know this, but before I ran for office, I worked at Planned Parenthood. I started there as a patient. I was looking for access to contraception. I started volunteering there as a health center escort when I was in college, hired at a very entry level, and served as the Senior Director of Public Affairs and Communications across 22 counties. Rep. Skidmore says that every decision is a valid decision to end a pregnancy, and I would 100% agree with that. None of us should be dictating what is a bad abortion and what is a good abortion. 1 in 4 American women in this country have made the often complex decision to end a pregnancy, many who are already mothers, making this decision as a mother. And they do so walking past protesters. They do so for fear of even telling their loved ones because of the shame and stigma around it. They oftentimes leave with very little support from those that are around them. And yet, here we are, instead of finding ways to support women and to make sure that their decisions are affirmed, we are not only shaming them, but we're also shaming those with disabilities, drawing this assumption that your life is not valued if you live with a disability. There are people with disabilities in this room. There are people with disabilities in my district. None of them come to me about this issue. A mother of a child with special needs came to my office because her insurance company was denying coverage because they were diagnosed beyond a specific age, which meant the insurance company wouldn't provide any coverage. I've toured nonprofits in my district that provide hands-on experiences and training and safe places for adults with disabilities. They are severely underfunded. And so if we really want to focus on disability issues, then let's do that. But please remember, members, that reproductive rights and disability rights are both human rights. And fulfilling human rights requires attention to both of those. And that includes women, transgender folks, men, non-binary people, all people with disabilities. Everyone faces barriers to full, equal social, economic, and political participation. And this bill does nothing to address that. And I think what I find just most concerning is this really is part of a national effort to ban abortion, no matter how you paint it. You can try to carve out a specific community of people, but at the end of the day, this is about banning abortion, and it's not original. We have seen these type of reason bans across the country. Speakers have said that. And so again, we've already seen these cases get knocked out in different courts across America. It does not reflect the innovation of this legislature, a legislature that can fix these problems, to pursue this type of policy. And again, we should not be in a space to shame and judge people who are making their own personal, private medical decisions. And I'll tell you, talking to patients who've made this decision, it is incredibly diverse. Many feel like they have to explain to you why they're here. And when I worked at Planned Parenthood, every day I would remind them, you don't have to tell me anything. You don't have to give me excuses or reasons. You are here, you are brave that you are here, and we love you and we support you. And that's what this legislature should be doing. Not shaming someone and then putting a pamphlet in their hands and telling them good luck. That is not what we should be doing. So I will be voting down on the bill, and I encourage all my colleagues to do the same.